So my name is Nellie Hernandez. I'm a bilingual dementia educator with Alzheimer San Diego. And this is who we are. I like to tell everybody that we are located here in San Diego County in San Diego City. We're a local nonprofit. We're independent. That means we're not associated with anyone else. And what we're here to do is really be able to provide services to the community with keeping this in mind. We're here to really work on enhancing the quality of life of those affected by dementia in San Diego County. We offer programs for caregivers, but we also offer programs for those living with dementia. And why we share that is because oftentimes a lot of folks don't even identify themselves as a caregiver or a care partner or somebody that's caring for somebody that has some type of memory loss or dementia. But rest assured, we're here to support you, and we're here also to support you yourself if you have any concerns for your uh, brain health as well, right? So, whether it be a supportive service that we can help out with, whether it be education that we can support you with, or whether it be social connection, because we'll talk about a little bit about why social connection is so important. And like Faye mentioned to us, one thing we know is that it is very unfortunate that dementia is being seen more often and is definitely rising. So there's our information. This information will be shared to you with you so that you can have it in hand and reach out to us as needed. But let me give you a little bit information by starting talking about what dementia really is, because this is probably one of the biggest questions I often get out in the community is, well, I'm not really sure when you're talking about dementia, what are you talking about? So think about it like this. Dementia is a general term, it's an umbrella term, it's a group of symptoms that's caused by an underlying medical condition. And here's what I want you to keep in mind. The medical condition and the dementia impairs the cognitive function, it causes behavior changes, and it interferes with normal daily living activities. So, the way we live our life, the dementia starts interfering with that. That is how we know that it's a type of dementia. And what it is not, and we're talking about dementia, the word, it's not a specific disease because there are many types of dementia. It's not a normal part of aging, so we're not all going to go through dementia or a type of dementia as we're getting older. And like you heard Faye say, the older we get, the more we are at risk for developing a type of dementia. And again, here's something that people are often surprised about. Dementia is not exclusively to older adults, although we are at a higher risk as we continue to age, but there is dementia that can often occur in folks as young as 30 years old. Okay. Now, this image that I'm sharing here, it gives you an example of the most common type of dementia, which is Alzheimer's disease. Now, Alzheimer's disease is a specific type of disease, and it is a type of dementia, the most common, like I mentioned. On the left side of this image, we see what our brain typically looks if it was healthy. On the right side, it gives us an example of what happens to our brain should it cross a type of dementia. In this case, it's showing the example of Alzheimer's dementia. And we can see right offhand that the brain starts shrinking, so it's definitely not looking like it was when it was healthy. And here ahead, we're going to talk a little bit about why that happens. Let me tell you first about some signs of dementia, because that's the next question that we often hear is how do I even know, or how can I distinguish if this something that I need to talk to someone about? Okay, first of all, if you see recognize a change, it has to be a marked change from what is normal for the individual. And that change has to be significant enough to interfere with the daily activities. For example, One thing that we often hear is well, the person kept repeating the question after I had stated the question to them or giving them instruction to them several times. So the person you may find may be asking the question again, maybe seeking clarity because they just aren't able to follow the instruction that you maybe have given them. Is that typically normal for this person? Is it a normal change from the individual? And is that change starting to affect the way the person can do a daily activity or the way they used to do a daily activity? Four primary areas that are affected when somebody has when somebody has some type of dementia, the memory begins to be affected, the thinking begins to be affected, the physical body begins to be affected, and the behavior begins to be affected. Now, think about what I just mentioned in the very beginning, that it affects the way a person lives. If these four primary areas are affected, of course, it's going to change the way we do things. It's not going to look the same. And these changes that we're seeing are the times that we need to stop and say, you know what is possibly happening? Who can I talk to this? Who can I talk to about this? Or what questions do I need to ask? Another one that we often see folks do is maybe they start misplacing things and they don't recognize that they're putting things back where they don't typically go. Maybe they're no longer able to identify objects the way they did. They don't recognize what the keys are for. They don't recognize the use of a pencil. They're not any longer able to recognize how to use can opener or what it is used for. And these are all just simple examples that we often like to bring up. With this, we like to move forward to talk about specifically Alzheimer's disease because, like I mentioned, it is the most common. And just as a reminder, it is a disease of the brain. It's progressive. So that doesn't mean, so what that means, is it's not going to get better. It's probably going to look different and get worse. It's not going to get better. Unfortunately, there is no cure. And this is where I typically hear folks say, like, well, what about medications? I'm going to let you know right now that's something that you always want to take up with your doctor. That's always an option. But oftentimes we know and we hear that those medications are not a cure medication, it's a medication to help with certain symptoms. And remember that since it is degenerative, it can look different for everyone because our bodies are all different. And although it is the most common type of dementia, just keep in mind a person can have mixed dementia as well, where they have more than one type of dementia, which they often can have their own symptoms, even though the person is going through multiple symptom changes at the same time. Since we are really talking about the end of life or planning for the end of life, I decided to go ahead and share what the last stage of dementia might look like. If you come in contact at any point with Alzheimer's San Diego, we often talk about three stages of dementia: the early, the middle, and the late. Again, we're only going to be briefly speaking about the late because we're talking about what do we need to consider if we are getting toward the end of life, whether it be us as the person or whether it be the person that's acting or in the role as a care partner or a caregiver. What do they need to be aware of? What are the things they might need to educate themselves about so they can continue to give the best quality of life to this person with the most dignity as possible? This is a picture again of the brain that I want us to look about while we're talking about what you should expect at the end of life. Remember that because it is a progressive disease, as the disease progresses, the person's capabilities of taking care of oneself. And again, the way they interact with their daily life activities are going to require more help. So oftentimes the questions that we get from folks is, how will I know when they're in the late stage? And what does that mean? How long will the late stage last? And what symptoms will the person that I'm caring for, or even myself, if I'm the one that has dementia, what might I go through at some point when I get to that stage? First, let me remind everybody that we often talk about too that when a person gets, if they get diagnosed with dementia, but when a person is having changes of dementia, um, oftentimes that person, if they're diagnosed with in the very beginning stages or even maybe in the middle stages, if they're able to still verbalize their preferences or what they would like their life to look like or what they would like their care to look like, these are things that we too, if we're not concerned about ourselves going through dementia changes, that we can also still continue to express to prepare for that end of life, right? And back to the person that might be going through changes, this is a great opportunity for us as care partners to speak to that person about what their preferences might be looking like, or them to be able to verbalize to us still what the preferences might be, right? And put things into action because we have to remember when a person is progressing through dementia, that means it could go between 2 and 20 years, we like to say, and you'll hear the variation in the time, but you got to remember as the person is progressing, the progression sometimes doesn't happen from one day to the next. It's through the years that the progression takes place. And even if the person is diagnosed with dementia, that doesn't mean that all those other medical conditions that the person might be going through or the symptoms they may be going through from those conditions go away. So it's not Alzheimer's takes over the other conditions or the other conditions go away. It could be now the person has not only the symptoms of other conditions and also the symptoms of Alzheimer's. So you can see why we often talk about why it's important for the person to get support that's going through the changes and why it's so important that a caregiver, a care partner understands how much needs to be learned, so how much can be learned so we can still continue to share in the best life possible while those um, changes take place. Now we're going to go back a little bit to thinking about what we just saw about the brain and how it begins to shrink. One thing I want to share with everybody that's I think is really helpful to try it and learn is that the brain has different lobes, and those lobes all have a responsibility to our body. Now, when we saw the brain image here a minute ago, we saw how the brain begins to shrink. And we know that as that happens in all those areas that are no longer functioning, how will our body get instructions from those lobes if they're no longer talking to our body? Now, moving forward to when we're talking about the end of life, we're talking here in this specifically about the brain and its functions when it relates to the cerebellum, because the cerebellum is responsible for fine motor skills and muscle control, balance, and speech, and the brain stem, which is talking about swallowing, body temperature, deals with our digestion, our sleep cycles, our heart and lung function, and breathing. Now, think about this, what I just said. Every lobe has a responsibility to our body. If these particular areas of the brain, the cerebellum and the brainstem, are no longer functioning because the disease has progressed into these areas, our body doesn't know what to do. And as that happens, our body starts preparing for the end of life because it's not responding. And here we can see how sometimes folks say or bring up, listen, my person is going through dementia and they just don't want to eat anymore. Think about our words. It's not that they don't want to eat, it's that their brain is no longer sending the instructions to their body that are necessary for the person to really do the act of eating. Think about it. The swallowing, the body temperature is now changing. And even if they did get something down, how is it digesting? The digestion is starting to slow down and change as well. And the heart and lung functionings. And think about this, our heart is what pumps the blood and the circulation to our brain to keep the brain talking, to keep those neurons functioning, to keep those instructions continuing to go to the rest of our body. So we can see how much those muscles and all our body system is just not responding to anything because there's no more instructions being sent. And at some point, that is going to also affect our breathing. Okay. Now, sometimes folks ask us, well, listen, how big of a deal is this? But you just heard Faye talk to us briefly about an article that she read and the impact of dementia alone in the United States. And let me just say thank you to those that are reaching out to us and connecting from out of the area. We appreciate you sitting in and being able to share this because whether you're out in the area of San Diego and you may know somebody here in San Diego that at some point has concerns or is going through changes, or that you are the connection for that person to be able to get support, then you're in the right place because the impact of dementia in the United States is we know that there's more than 6.9 million Americans living with Alzheimer's disease. Now, remember, before you may have heard me say if a person gets diagnosis, these are the people that are actually reporting or being reported as having a diagnosis. Imagine the people that will continue to live and are living right now without a diagnosis. There's probably so many more. And just with those that are reported, there's 6.9 million. So imagine how much more that number could be. And approximately 1 in 3 folks that are older adult is actually passing away from Alzheimer's or another type of dementia. Because again, remember, we can guess that there's so many more people that are living out there for many reasons without a diagnosis, right? But more than 11 million Americans are providing unpaid care to someone that's living with dementia, whether it be because they don't know that the person actually has dementia, whether it be because the person doesn't identify themselves as a care partner, as a caregiver, or somebody that's actually giving care to a person that's going through that change, right? These folks are doing it and they're not getting paid. Imagine how that is impacting the life around us. It's a contribution to the nation that's valued at $350 billion a year. Okay, so we can see that the disease, Alzheimer's, because it's the most common, but just even any type of dementia really puts an impact not only on the individual because of the needs that they're going to have, but as a person that's the care partner, as the family, as the community, and as all of us as a community together trying to support each other to just really have the best dignity we can and enjoy life. So, my suggestions to all of us is these are some of the things that we can consider to reach out and get support, to learn a little bit more about really what is dementia, how is it going to impact my life, but even furthermore, how can I as an individual in the community support someone that I may not even realize is living with dementia or that's concerned about dementia. So we already know we can continue to learn about the physical and functional changes that can exist, not only through our classes, but to speak to somebody directly here in the office that can walk you through whatever your question might be and really support you on an individual basis. Strategies for connecting and communicating, not only for ourselves, but again to those folks that may be going through some type of not only just memory loss, but other changes, whether it be their cognition or already changes with their daily living. We want to make sure that we all stay connected because it's so important to our well being. We want to be able to not only keep moving, but also be connecting so that we can create better habits and just, again, our overall well being of our uh, tending to our needs, even if that means a care partner tending to figuring out how to best give myself some self care. What is that? How does it look like? And where should I be reaching out? Transitions for the end of life. You heard me briefly mention that not only we need to educate ourselves on what that might look, but why not take the opportunity to see how I can learn about the different options in self care planning or care planning in itself? What are the options out there? What are the options for seeking out care for someone else to come into my home or seeking out care for an option to move my person into a different type of care that's needed for that person. These are all parts of transitioning for the end of life. Learning about what I might plan legally, all something you can talk about with someone on an individual basis. How to provide the best comfort and personal care, not only to the person going through the dementia, but for myself to express where can I get this information out to somebody that might be able to support me as I'm on my journey through dementia and the symptoms and the changes that are to come, right? Care planning resources, and most of all, how to connect with what are coping strategies that I might not know about? What are coping strategies that I might not even be aware could be helpful to me or someone around me? These are all supports that I just encourage all of us to feel comfortable to connect with Alzheimer's San Diego about and really learn how it might be utilized to bring more joy to our life, bring more balance, and just be able to really, again, build better memories as we go along. Why I say that it's important is you heard me say too that our bodies are all different and so are our situations. All our situations are unique. That's why we encourage everybody to really seek out to get that support on an individual basis, whether it be a checklist that you're not sure how it can be helpful to you, um, for your planning, whether it be developing an arrangement so you can have a family meeting to better see or better understand how you might go about having these conversations or how you might be even creating the opportunity to have these conversations. Call us for guidance. We're open 8:30 to 5, Monday through Friday. Rest assured, you can also reach out to somebody online if you think that might be helpful. And I just want to really remind everybody that there are more services available to everyone at no cost. You never have to meet any type of eligibility or any specific criteria to be eligible to speak to somebody here, whether it be speaking to somebody that feels that is a dementia support coach to you, whether it be learning how you might be able to connect socially to an activity, whether it be in the office or out in the community, and learn the benefits of what that might look like to your life. Whether it be somebody that's living alone, if it's you or somebody you know that might be living alone and need to have more information on how you can get somebody to support you, connect with us and bring your questions. I'm going to take a minute here to look and see if we have any particular question. Somebody mentioned you cannot see the speaker. Yes, because this is in a webinar setting, but just know that you're probably going to continue um, to have other webinar opportunities. If you come to Alzheimer San Diego for Connection, there are recorded webinars. There are webinars you can sign up with that you will not see anybody but the speakers on there, but you're going to be welcome to connect if you have other questions about that. Let's see. Somebody says here, I have heard that the hospice time limit qualifications for a person with dementia are somewhat different from a person with another terminal disease. Is that true? Honestly, I wouldn't say that I really have a clear answer for that. I would suggest a couple of things. Number one, get connected with somebody in our office that can probably give you better guidance than I can with you. But I do want to encourage you to maybe listen to our webinar on the care options that are available. They go into the different care options that are available out there that you may want to consider, and that might be hopeful. And in addition to that, there's also some resources that they talk about there. But rest assured, if you want a specific resource, reach out to somebody in the office that they can help you connect with that. This is a mission statement of the Alzheimer's says that they want to support those affected by the disease and caregivers. However, there's no info on the website regarding the peaceful, quick, painless, and legal death available as an option. You, Diana, that you're the one that's bringing that up. You want to be able to make sure you connect with somebody if you want to talk specifically about how that option is available in the community, if that's something that they can meet with you directly about. But I will tell you that the stance of San Diego is to make sure that we provide resources to an individual on an individual basis, whatever their interest might be, or where they can seek out more information for it. Okay. Anything else that I may have missed? Let's see. Do you usually see new people with early symptoms of forgetting dementia early enough to ask what their choice is for either continuing developing complete dementia or choosing other EOL choice? Yes, Stephanie, there are times that folks come in and they're encouraged if they have a concern or that they may have noticed something is changing with themselves, or somebody may have brought it up to them that they've noticed changes. Oftentimes, what is encouraged is that they start with the memory screening. A memory screening is sometimes something that folks aren't familiar with. They start with the memory screening. That's something that they can take to their medical doctor, that they can have further discussions about it. That tool is not for diagnosis purposes. It's so that we can actually see if there is something that they can talk about with their doctor that they can start using as a point of reference. Okay, so that's maybe helpful in that sense. And also, if you want to, you can also jump in and learning more about what actually the dementia symptoms are. And if you think that you're going through some of those changes, again, that's something that it's a flag for us to be more to bring more advocacy to ourselves, or to be a self advocate to say, you know what, I think that I'm going through something changes, and going through the medical doctor is perfect because they can also talk to you about other conditions that mimic symptoms of dementia, which you might not even realize that you're going through or having. Okay. Let's see, MCI and mild early stage Alzheimer's patients don't have a 6-month prognosis of death. Therefore, they can consider ending their life legally as long as they still have cognition and no one. Okay, well, thank you for sharing that. I would love to also hear about choice of dying for folks for dementia. Well, we're not going to be talking specifically about that, but maybe that's something that you can all work on talking about here in the future. Let's see. I'm just trying to read some of these. Is a lot of information that folks are sharing, but I'm not seeing quite the question. All right. Well, I don't think I missed any questions there. I don't know if there's other questions that somebody may have caught. Again, thank you for those that are sharing a lot of information on there. I think that that's something that you all can continue to have a discussion about. I just want to remind everyone that should you have questions specifically that relate to something that you want to learn, you can always reach out to Alzheimer San Diego, or you can also reach out to see if they can provide a resource in the local community that might be helpful to you. Does anybody have any specific question that relates to what we actually talked about today, or that I can support you in another way to get more information?
Nellie, thank you. You can see that our group here is pretty savvy about Alzheimer's. I mean, we're very sensitive to it, so they already know a lot of information about Alzheimer's, and their questions are really have to do with end of life choices for, if they're battling a dementia of some type. And there was one question that came in through the Q&A from Kathy Butterstein, and she asked, how do I decide to end my life before I get to the end stage? How do I get a diagnosis? So is that something, I'm sure you can help with how do I get a diagnosis, but then do you at Alzheimer's San Diego, do you have counselors and people that work in answering questions for people who don't want to go further down the line with dementia? Do you work with them on being able to get a peaceful death?
We do. Hemlock does.
I
I
know
know
we
we
get
do
that
that
out
out
of
of all.
yeah.
My screen is going crazy, so give me just a second. So back to your question, we would want someone to speak to a dementia support coach about specific questions that they may have. You have to remember what the mission of Alzheimer's San Diego is, and that's for folks to be able to be supported so that they continue to live with dignity. Anything outside of that, you may ask them where else they can connect to a resource. But as far as them getting guidance through how to proceed with that, I'm going to safely say that that's probably not something that they would walk you through. However, that doesn't mean that they wouldn't connect you to a resource, because that's what they're here. They're here to support you to connect to a resource that might be helpful to you. Okay. And they're here to support in being able to meet with either you or a family that's locally, so that they can support the conversation, which is oftentimes where people need and find themselves starting.
Great. And you can use Hemlock Society of San Diego as a resource, because that is something that we help people with as far as legal ways that they might be able to achieve a peaceful death if they've taken the road down dementia as far as they want to go. There was another question. Oh, and it comes from our friend from Australia, I believe. So what point determines when a dementia patient should go into aged care? How long should carers try to soldier on with their loved one at home? I don't know if you have a feel for that with the people that you work with.
You're going to have to speak to a dementia care coach specifically about that, because that's something that's really going to, they're really going to guide you to try to think about many things that we can't go into detail in a webinar. But I'm going to encourage you to watch maybe the care options in the late stages that's available in our video webinar online. That might be helpful to you. And there's also one that's called, give me just a second. I think it's called preparing for a good end of life. And again, I could have recalled the title being a little different, or not right exactly as what it's called, but there are webinars that are available. If for some reason they're not recorded and available on the website, that doesn't mean that they're not being scheduled to be taught in the future. they try to keep something available for someone to access it online, but sometimes, to be honest, it's tricky to do, and we want to make sure that we always remind everybody that you can receive the calendar and keep looking for it. The calendar changes every quarter, and that might be helpful to you, because there's a lot of factors that you may want to consider before you decide to have the person live outside of your home. But that is an option. And I would say that it's really on an individual basis, because I don't know what your life looks like, and I don't know all the things and the circumstances going on around it. And that's why you want to spend time talking to somebody on an individual basis.
Okay. And I just want to bring up, so Diana Martinetto, hello, Diana. She wanted to make sure that people realize that Final Exit Network can help people with who have dementia that still have mental capacity. About 12 to 14% of the people who utilize Final Exit Network as a way to achieve a peaceful death have dementia, but still enough mental capacity to make that decision.
Yeah, and I don't want to interrupt you, and that's back to the questions that we got before. That exactly what you're bringing up. Thank you for sharing that, because that's exactly what happens here. The coaches want to be able to remind everyone that what we're about is you connecting to a resource that might be available to you as an option, because that's really what we do, is be able to bring light to all the options, not for any of us to decide what for who. It's for us to recognize the options are available and respect how each individual chooses or not chooses to use those resources as an option.
Beautiful, beautiful. There's another question here from Sarah Scheinbach. She asks, is there a way to measure progression of Alzheimer's that allows planning? So people who are going through the disease, do they, when do you suggest that they really start doing some planning?
That's a great question.
I know my answer.
What I often encourage everyone when I meet them out in the community for education and informational sessions is I say this: we all of us really need to try to focus on having conversations. Personally, in my opinion, I feel like because there's still so much stigma, we don't have enough conversations about the topic. Therefore, it keeps us from being able to really recognize if we see symptoms or if we're concerned ourselves about symptoms. And since we don't do that, that too hinders us from going forward to actually expressing what our preferences would be. So my suggestion would be, first, start having the conversation openly and get ready for all those things that might come up that might feel uncomfortable. And once you do that, then you'll know that you're going to have to recognize and start educating yourself about what are symptoms, so that if you're the care partner, there's two things. The care partner can start modifying how they're actually going to respond and really support this person through those symptoms. And the person that's going through those symptoms is really going to have to try to build a support network so they can start expressing what their preferences are. And that doesn't really always have to mean verbally expressing them. That can mean so many things because it really has to do with communication. So it's really finding that balance to figure out, are we having the conversation the way we should? And how are other ways that this person might be able to express their preferences to me, rather than me just waiting for them to say, when XYZ happens, what I would like to see happen, it might be me the other way around. It might be me having to say, you know what, as you're going through these changes, Janet, I mean, I see right now that we're having to work on our communication already. What would you like to see happen? Is it this or this? Or I noticed that you really like this. Is that what you want to see happen? So it's really, again, trying to think of different ways of communicating for us to ask questions, collect information, and the other way around, also give our information as best as we can. So a lot of things are changing when it happens.
And our very wise Dr. Carl Steinberg here, he always has great comments. And anyone asks this question about when should you start the planning, he says immediately, even before a diagnosis. And it's true, we all need to have these conversations with our loved ones. So
Come on, we all got to get comfortable about talking about what we want. That's
yes,
okay. We can say what we want when we want it. If it changes, and the same thing, we should be feeling comfortable to ask, what do you want? And when don't you want it? Because again, like I said, there's going to be things that they don't sit with well, or they might be uncomfortable, but that's part of breaking the stigma of so many things, is being able to find that balance of give and take and listen and hear.
right, right. And Patricia Keeney gives us a good reference that she recommends Barbara Lee Coombs' book, a chapter in there that's called, the book is called Finish Strong, and the chapter is Escaping Dementia. So she speaks kind of specifically to that. Stephanie Tarkenton asked a great question about, can a series of MRIs every 6 months help to see the extent of the disease progression?
Oh, you know what? I mean, a series of MRIs, that's a tough one for folks to get. And to be honest, this is the kind of the way I think about it. What I know to be true that I always think about is, if you go way back to how just Alzheimer's disease got its name, right? With Dr. Alzheimer's, didn't really recognize that this person had dementia until the autopsy was done. So I always think about that. Like, in reality, we don't know what the brain totally is going on until we are gone. So I'm gonna just go ahead and guess and say I'm sure that we might be able to see something, but I don't know how much we will be able to identify the progression of it. But I'm no medical expert by any means, so don't take my word. I'm just sharing my opinion and thoughts on your question on in broad strokes.
Yeah, yeah. And again, Dr. Steinberg kind of spoke up and said basically the answer is no. There's really not a series of MRIs to be done to watch the progression. It's probably more symptomatic, watching
Yes,
symptoms.
the only thing we see is the reason why I often talk about, think about the brain that is shrinking, and when it's shrinking, less things are talking and less information is going to the body, is because of that. Because on the outside, all those changes that we're seeing the symptoms, and we're having to really put ourselves out there and learn, how do I modify, how am I going to respond to these symptoms that are now affecting the way person moves or doesn't move, and to what extent can I support that change?
Yeah,
And that's
and
kind of how
he
I
further
see it.
says, that you're better off following simple cognitive testing and functional decline, like the FAST scale. So he does give some objective ways to sort of follow progression. Um, there was another one that came in from one of our other board members. She's asking whether or not, um, is there a tax write-off for memory care community for those with a diagnosis of Alzheimer's? Whether you know about that.
I personally don't know, but that doesn't mean somebody else on our staff doesn't know. So I really don't know about that at all.
Okay. Nellie, thank you. As best I can tell, that covers our questions. And I think we're going back to Pam for another part of this program today.
Well, thank you, everyone. I hope you find something to at least think about. And I hope that you can utilize the service in trying to understand how to connect to another resource that you have. And you know what? Thank you to all of you that attended, that seemingly are providing such a support to each other in the community to, again, connect those resources. Because if we can't connect each other to something that might be helpful, then we're not practicing good community in my sense. So thank you, and kudos to you guys for showing up and supporting each other in that way.
Thank you, Nellie.
And I'm going to read a statement from Jean Fisher, and this is Jean on the screen. She is an Alzheimer's patient, and she's courageously offered to share some thoughts with you today. Um, this is Jean speaking, and she will not be able to take questions today. I was diagnosed with Alzheimer's and primary progress aphasia within the last 3 to 4 years. I've also been a member with Hemlock San Diego for about 10 years after my dad died with dementia. When I was first told that I had dementia and needed more tests, I was shocked. As a caregiver, I remembered my dad. This was different, though. This time it was all me and will be all me. Alzheimer's San Diego is the most detailed organization where I've learned the majority of living my life with Alzheimer's disease. I have learned so much I did not know about because I was new to Alzheimer's San Diego. I attended some meetings twice or even 3 times. I enjoyed the meetings so much and meeting new people who were in my life zone. I also learned something new, and we were given excellent papers at meetings to take home. I still have them to read, and they will stay with me to the end. We had meaningful discussions in our meetings where I learned even more. This is an excellent organization for me to learn and for all those living with Alzheimer's and caregivers. After one Alzheimer's San Diego meeting, a woman came up to me to say thank you for speaking my comments. The woman's daughter waited away from us and allowed her mother to talk to me alone. The woman and I both hugged with tears when she told me this was her first time at a meeting with Alzheimer's. I told her that I've attended more meetings and I was coming back because they made me feel safe. We were helping each other and not just ourselves. We were understanding each other, which gave us strength to know that we were not alone. There is a feeling of comfort when asking questions. I was in classes with people living a life as I was living. Some people spoke and some did not. There were caregivers, people asking questions. I had people come up to me after meetings to thank me, and at times we talked with each other even more. I will stay with Hemlock San Diego and Alzheimer's San Diego because I love being with both and for very different necessary reasons. They are also both good to me. They meet my needs in different ways that help me to live my new life. The difference is how to end my life when I want to and under terms that meet my final needs. Yes, we can all live together with different needs. It may not be easy, but there are times when we do need each other. I didn't think it was good for me, but it is working because I have learned how to accept and support those who are different from me. I have wonderful people at Hemlock San Diego who support me, and wonderful people with Alzheimer's San Diego who also support me. The truth is, I need them both to help make my future solid. Thank you for listening and understanding.
Thank you, Jean, so much for sharing that. Jean is one of our cherished members and always has a positive outlook, and it's just a pleasure. So thank you
Thank
so
you so
much for sharing
sharing
that.
that.
Can I just say something about our future meetings and our past meetings have been really concentrating on dementia and Alzheimer's disease. We will have a program in March and February and May and subsequently on different aspects of dementia and Alzheimer's. And I would like to know what specific programs are available from Alzheimer's San Diego, but that's another program, I guess. Okay, I'll get off.
I, are
Are
you
you
talking
talking
about
about
what
what
specific programs
programs
are
are
available
available
within the
within the
service?
service?
I was talking about whether you have support groups or you have, I don't know what you have, so that's what I was
Oh,
trying to figure
correct.
out.
It
It
was
was
on the
on the
screen that we shared, but rest assured, you are going to be getting a copy of the PowerPoint. And on one of the slides, it actually gives you all the services that are provided along with the contact information there.
Okay, well, Faye, did you have anything that you wanted to say in conclusion, to wrap today's meeting up?
With the audio here. I do want to say that please be tuned for our February meeting, which will talk about a dialogue between an Alzheimer's patient and his wife, an actual dialogue, and a good Chinese lunch. And in March, we'll show the movie Still Alice, about a woman with early Alzheimer's. In May, we'll have a speaker from Tufts University talking about his book about Alzheimer's and choosing a good death. And we have lots of programs. We have had several programs already. It's a very serious concern for us and our members, and I see people on the chat very concerned with if you have the diagnosis, do you have to live with it to the very end, which is a very important question. I guess that's all.
Okay, well, we thank everyone for today, and enjoy the rest of your Sunday.